I'd like to welcome everybody to today's webinar titled Patient Engagement Equals Better Outcomes, Effective Use of the Patient Portal, Creating a Buzz to Engage Your Patients. My name is Scott Mash. I'm with the Ohio Health Information Partnership, also known as CliniSync. And today our co-presenter will be Mr. Kevin Waller, who is the Director of Communications for Holzer Health System. I would like to thank everybody for spending your Pi Day with us, as well as extend a huge thank you to Kevin Waller from Holzer Health Systems for sharing the Holzer Health System experience and the steps they took to be so successful with their patient portal. You know, I personally feel that it's always great to hear these messages directly from the groups that have a demonstrated success in an area. Also, I want to remind everybody that this webinar is part of our Improving Ohio's Health series, which we do in conjunction with the CDC and the Ohio Department of Health. You can ask a question at any time using the integrated questions feature of GoToWebinar, which you can see the steps to enter those questions now. You can enter those questions at any time. We will answer the questions at the end. Handouts are available, which you can see here how to get to them as well. The handouts you'll find are a copy of today's slide deck and a copy of the article that accompanies this slide deck. Our topics today, well, of course, we're going to define what patient engagement is, talk about why it's important. We'll talk about the advantages of using a patient portal to manage your patients with chronic conditions, especially those with prediabetes, diabetes, and hypertension. We will highlight some of the barriers to a successful portal rollout. Then I'm going to turn it over to Kevin. He's going to talk about the techniques, the plan that they used at Holzer Health System to improve their portal usage, and the numbers were dramatic. They did a great job. Holzer has been actually highlighted by their EHR vendor for the success that they had. And then we will wrap it up with a Q&A. Now this webinar today kind of builds on one that I did last year, which was titled Technology Tactics to Make Patient Engagement Easier. It did talk a little bit about portals, talked about some other technology that's out there and that's emerging and that can be utilized. I thought it was important to kind of share those links to both the recorded webinar and to that article. And don't worry about writing these down. You're going to get a copy of the slide deck. So first, I really think we need to take the time to define what patient engagement is, and then talk about why patient engagement is so important before we start to get down into the details of the patient portal itself. So first, what is patient engagement? Well, you're going to find 100 different definitions. Here's how I define it. It's a strategy using both tools and actions of the care team, the physician, and the patient that leads to the patient doing self-management. It leads to shared decision-making, and then that in turn will lead to improved outcomes. So why is engagement important? Well, if you get a patient engaged in their own care, it's going to reduce the healthcare costs. It's going to increase the quality of care. And what I mean there is when the patient is in for a visit face-to-face with the care team, they're going to be more engaged. They're going to be more informed. It's going to be a much more meaningful visit. An engaged patient also has a lower likelihood of being readmitted into the hospital or being initially admitted, but definitely dramatically lowers the likelihood of readmission. And again, it's all about improved outcomes for the patient. You know, a patient that is truly engaged in their own care, they are going to make use of those preventative care visits and making sure that they're doing all their testing, and they're going to be much less likely to run to the emergency department or end up in the hospital. They just take better care of themselves. Now, I did carry this slide from the last patient engagement webinar that I did, but I did so because I really think this kind of embraces the idea of, or the concept of what patient engagement means. And it really means something different to everybody across the care continuum. You know, I'm an IT guy, so for me it's going to look at the technology, it's going to look at the data. For the clinical team, it's really about shared decision making. It means something to everybody, but the important thing is that you define it for yourself. You understand your role. If you're leading the project, not only do you define it for yourself, but you try to define it for the organization. Put together a plan, work towards that plan, define milestones along the way, and whatever you do, just don't give up. There are going to be certain patients that you're just not going to get engaged. Other patients that you just need to find the trigger, the channel, the means to get them engaged, and that's going to take work. And then there's other patients that are just automatically just going to get engaged with very little effort. Develop your plan for a broad set of communication channels, communication mechanisms, and for a broad array of patients. So why is the portal such an important tool? Well, it boils down to folks are just used to using technology. You know, everybody sits at home and Googles their conditions or their symptoms. Sometimes you're going to read horror stories about, you know, what you may or may not have. But folks are doing this. There are approximately 4.7 billion Google searches done every day in general, and Google estimates that 1 in 20 of those are folks looking for health-related information. 77% of patients do a search for their issue or some condition or symptom that they're having prior to booking an appointment, probably scaring them into booking that appointment. And they say 60% of internet users look for online information about their specific condition. So the portal becomes critically important because, for one, patients are used to using the internet, and the portal is it's just another website, but that's the one place that you control the information. You control what's being shared with the patient, where the patient can really see information specific to their condition, specific to their test. You have control. So we really need to make sure that you're rolling information or pushing information to your portal that will supplement the visit. So let's talk about the direct advantages of a patient portal. For one, it's integrated with your EHR. So that patient's information, their problems, allergies, meds, all their vitals, care notes will flow over and be specific to that patient. Educational material, you can push the educational material to most portals. Some portals even have supplemental educational material or links to approved educational sites. What this does is it really encourages the patient to take ownership of their own care, because they can see where their A1C was over time, or was it last visit? Did I get better? Did I get worse? I can't remember the name of that med. Oh, hey, here's the name of the med and educational material about that med. It just really encourages the patient to become a partner in their own care. Also, the portal can really build a relationship. It can assist with establishing that provider-patient relationship that is critical to real patient engagement. The two primary tools within the portal, there are others, but the two primary ones are the secure messaging feature. This exists in every portal that's available today that was used to meet meaningful use. It was one of the basic functions that had to be there. Now, the key is to make sure that somebody responds in a very timely manner to a secure message. Doesn't necessarily need to be the physician. It can be anybody on the care team. Anybody who has that information or can get the information or answer the question that the patient has, respond as quick as possible. Treat it as a conversation back and forth, and it fosters a relationship. The appointment reminders is another means within the portal to get a patient engaged. Folks are busy. We sometimes need that trigger to say, hey, next week you got an appointment. It's very basic functionality, but it really goes a long way. Now, keep in mind, the only way you're going to realize any benefit from your portal is if you make the most use of it. You're using all the functions. You're really pushing it. You're marketing it. Kevin's going to talk more about this here in a little bit to share his experience and how Holzer embraced the portal and their numbers just shot through the roof, and they have some good cases of real patient engagement through the portal. Now, there has been a ton of research done on the benefits of the portal and how it improves outcomes and how the impact on care teams has truly been minimal. Now, the number of studies directly on patients with diabetes and hypertension, that's a little bit more narrow. I did my research to try to identify those studies, read through them, so I could have a few really good examples of how the portal can be used to improve the care of hypertensive and diabetic patients. Now, keep in mind, just having a portal will not give you these results. You have to embrace it, utilize it. Every member of the care team has to believe in the portal. Now, one study did find that patients with diabetes had improved outcomes as a result of the information available in the portal. These patients had both reduced A1C and cholesterol levels, and I've provided links to each of these studies below. One study found that patients that are required to author a diabetes care plan within the portal, so every time they had an appointment, they would either go in and author a care plan or update their care plan. And within this study, they found that the rates of medication adjustment at 12 months due to proper management of their condition was dramatically high. I mean, the patients were doing a great job managing their A1Cs, so they required less tweaking of their meds, at least increasing their meds. Most of them decreased their meds. Another study found that secure messaging led to early clinical interventions. This study said that patients that were able to send and talk to their care teams through secure messaging had they had a much better outcome of managing their A1C. If it was running high, they could say, something's going on, I'm working on my diet, here's what I've been eating, can you give me some feedback? And so the patients just, those clinical interventions, they didn't wait until the next time they were going to see their provider. They used that secure messaging feature and were able to get their A1Cs back in control. Now, another study that was focused primarily on hypertensive patients, and this study even focused more narrowly on patients that were newly hypertensive. They had a program where they were trying to use their patient portal, and they were monitoring patients that utilized the portal and patients that weren't. They all found that the patients who utilized the portal and accessed their information and were able to reach out to the care teams, renew their meds, do whatever, had a 6.8% more likely chance of controlling their hypertension. So it can be done. Again, the studies are very narrowly focused at this point, but I do know there's a few other groups that are continuing their studies, again, around diabetes and hypertension primarily because of the high prevalence within our society. As you're rolling through portal rollout, or you're getting ready to kind of re-implement or re-engage in your portal, you will find that there are 3 primary classifications of barriers. Now, we're going to go into each of these, but I kind of break them into the technical barriers, an internal staffing barrier, and then there's some barriers around the patient. Now, we're going to dive into the technical barriers first. Now, I'm a techie. My entire career has been on the techie side, kind of healthcare IT, and I really truly believe that the technical barriers are generally the easiest to overcome. Now, when we think of technical barriers, first thing you've got to do is get that connectivity established between your EHR and the portal, and then you've got to define how and what the triggers are that will make that information flow from the EHR to the portal. You've got to keep in mind that there are certain federal and state regulations that you have to comply with that may restrict some data that flows over. For example, STD and pregnancy tests for minors, you've got to treat those differently, and those can be easily overcome. There's also the potential for multiple portals within a single health system. We've got one health system we work with that I know has at least 4 portals because they're running different EHRs. That can be a problem, especially if you try to technically bring them into one portal. Then the registration or activation process for patients is different with every portal, different with every EHR, so that may take a couple runs at to figure out the best means of getting those signups and those links built within the portal. Second one you got to focus on is your internal staff barriers. And generally, you will find that it's a preconceived notion that someone has based on a complete lack of information or misinformation that they've received from other sources. And you've got to hit these directly. You've got to educate your internal team on the advantages of a portal. If they have a concern, you got to hit that concern head on. There's always an assumption that patients having access to their lab results or to a radiology study is going to increase their anxiety. And what you will find is that it doesn't really increase the patient anxiety. What it does do is it's going to lend itself to questions from the patient, or they may need some clarification. But hey, that's the basis for patient engagement. Get that information. Get them to ask questions. They're reading this information, then they're halfway to engagement. All you got to do is close the loop with them. There's also a belief that the portal is going to increase workloads on physicians who already have more than enough to do in their care teams. Well, every study actually finds that the time on the care team actually is reduced because patients can call, they can pick up the phone to request a renewal. Well, they can do that through the portal as well, and it's going to flow right through the EHR. The provider will not have to be interrupted for a question from the patient over the phone if they use secure messaging. They can see that within, between patients and do it. And the questions really don't increase. It's just folks use the secure messaging as another channel to reach out. There's also a fear of liability for tracking and acting on patient entered data. Not only is there some liability questions, there's also the question of how do you properly incorporate patient-generated or patient-provided data within the EHR, and that can take some work. There are also some implications for change in the patient-provider relationship, and folks are always worried, how is that going to change the relationship? It is. It's going to get the patient more engaged. It's going to improve that relationship because now they have another means of reaching out to their care team. Probably the most difficult barrier to overcome are going to be your patient barriers. There have been tons of studies on the multitude of barriers and how to overcome them, how to change a message. Well, you're going to find that within your patient base, you can probably break those barriers into the socioeconomic factors, digital divide, and awareness. Now, every study will find that the portal use differs based on age, race, ethnicity, education level, and health literacy. So you got to make sure that when you're marketing, that when you're marketing your portal or developing, your banners or your handouts, you got to keep these factors in mind and make sure that you message the marketing materials appropriately so that they can be accepted by folks of differing education levels. You don't put in a lot of health lingo in it. You just kind of focus on, you're going to have access to your information, better access to your providers. We're going to send you reminders. Then you're going to find that the digital divide does remain. There are folks that just flat out don't have a computer. They don't have access to the internet. Then you're also going to find a subset of patients where they have a smartphone, and that's their only means of accessing the internet. Then you have folks like myself that I have 10 laptops at home. All my kids have a laptop, and we have cell phones with internet access. We have more connectivity than 10 people need, but you're going to see the folks that you just can't get on the portal because they have no access. Those that only have smartphone, got to make sure your portal is smartphone compatible, either through a browser or if it has apps. And then one that can easily be overcome is awareness. You're going to find some patients that don't know you have a patient portal, and if they do know, they don't see value in it because they don't understand what the portal can do for them, or that they just don't believe it's secure, so they don't want to log in. Well, make sure your marketing material and your marketing channels address all three of those issues. So now I am going to turn it over to Mr. Kevin Waller. All right, Kevin, I have you unmuted, buddy. Say hi.
Hi there, everyone. Can you hear me okay, Scott?
Yes, sir. Your audio is coming across great. Now, again, I asked Kevin to serve as a co-presenter because they have been highlighted time and time again by their vendor, who happens to be Allscripts, for their huge success with the patient portal, and they did it in a short amount of time. So, Kevin, I'm not going to steal any more of your thunder, and I'm just going to turn it over to you, buddy.
All right, wonderful. Thank you, Scott, and thank you, everyone, for being here. I will try to get through my slides quickly so that we have plenty of time for Q&A. I find that when I talk about this subject specifically, there are a lot of in my world, this happens, what did you do when kind of questions. So I will try to get to those all, and as you'll see at the end, I'm always happy to help anyone outside of something like this webinar, so please feel free to reach out to me. My success was based a lot on other people's success, and we didn't do anything revolutionary here. We just, a lot of us worked really hard on this, and we had a few good ideas, so happy to share those. So to a little bit about Holzer and who we are. We are a health system. We have two, Scott, if you can, there you go. We have two acute hospitals with 287 beds. My background is primarily on our ambulatory side, though. We have 15 ambulatory locations. Actually, we added 3 last month, so make that 18. We're doing some growing lately. But that's throughout southern Ohio and western West Virginia, and about 160, give or take, providers in many, many specialties. We have a pretty good continuum of care here, and have definitely, we're the primary healthcare provider in our region, and not a lot of big city here. We're a pretty rural area, so that presents some unique challenges when it comes to portal adoption. But to give you a little more background on before the portal became mine. What we now know is as MyHolzer, and I'll talk a little bit about that rebranding effort. But before the product came to me, the implementation was done and driven primarily by the IT folks at Holzer. And I also, like Scott, am an IT person, but I am from the operations side. So think servers, networks, data center type stuff. So I hadn't been involved. And we had a really fantastic group that got the portal off the ground. They're the ones that adopted very early before other organizations were even considering portals. I would give a shout out to Mike Weber. I'm not sure if he's on the webinar today, but he has been the man behind the scenes that makes all of it happen. And I would really encourage, one thing I'll talk a little bit more about later is relationships with the different teams at your organization. And Mike has been a great relationship for me, along with other folks in the applications department. I would really encourage you to get with those folks that are doing the actual behind the scenes work to understand your portal, what it is, what it's capable of, and what it works before you try to get anyone else to use it. So that's a little bit about us. On the next slide, you'll see some of the things I'd like to talk about and share. And again, I'll sort of jump around a little bit and breeze through these so that you'll have a chance to ask questions. But the 3 things that I would hope, or at least I would have hoped somebody would have talked to me about before I got this: defining the portal, being proactive, and meeting meaningful use. And a little bit reverse order there. Meaningful use, of course, is what got us here and brought this whole portal notion to us in the first place. Defining the portal, I'll talk a lot about the branding and the marketing, and being proactive. You'll see the classic field of dreams there. I came into this, when it was given to me, I understood it to be a if you build it, they will come type of deal, and it was anything but that. So I'll talk a little bit more about that. So we'll start with defining the portal. So what the heck is a portal? That's really the thing I found myself faced with. Before we rebranded, the product is called Follow My Health. That's the vendor name for the portal. Well, the word portal doesn't mean anything to your patients, and Follow My Health sure as heck doesn't mean anything to your patients. So that was the first challenge that I said we have to overcome this if we're going to get people to use this. So we rebranded, and I will flat out tell you that I had been at Lowe's that day, and if you go to Lowe's and shop, they have the My Lowe's program that remembers, what color paint you used and that sort of thing. So I absolutely just stole that idea from them, and that made an absolutely enormous difference for us, because changing from a product-specific name to MyHolzer really spoke to our patients, and that gets them open to what is this thing. Just a little anecdotal story. We have a health system somewhat in our region, and they have a TV campaign right now, and they keep talking about their portal in this TV campaign, but they don't ever say what the portal is. And every time I see those commercials, I just sort of shake my head and say, you're missing the point, because you're not telling your patient population what it is. You're just telling them to use the portal. So 4 things here that I would say would be the big, the big 4 as far, well, I'd say the big 3 as far as defining what it is. When you want to tell a patient what the portal is, the first and foremost thing that is the most popular use, which is number 2 on this slide, is renewing your prescriptions. My organization, we take about 1 million calls a year, and 15% of those calls are for prescription renewals. So right out of the gate, that is a huge number of contacts to your health system, and it's something that can be done instantly on the portal and easily. So that's the biggest thing I would say for defining what is this thing and what can it do for me. Second, I would say messaging your doctor. Using your EMR to filter the messages via tasking is what's the key to success there. So your patient just needs to know, hey, listen, I can send a message to my doc, and my doc will write back to me, and that's pretty cool. That's all they need to know. For you, filtering those messages, you may have a nurse, you may have a receptionist, you may have any number of folks that are actually getting back to the patient ultimately, and the communication with the doctor is happening via your EMR. But again, messaging your doctor directly is that advantage that defines it for your patients. And then finally, scheduling appointments. Whether or not you can directly schedule via your portal is going to depend completely and wholly on how open your provider's schedules are. And we could have a whole webinar on scheduling, and if anybody wants to talk about that, I'm happy to. It's a big part of what I do. But I would suggest if you're wanting to dip your toe in the water on this and you want to tell your patients that you can schedule an appointment online, I would start with follow-up calls. So what we offer essentially is, if you'd like to schedule an appointment, you can do that on MyHolzer. But what actually happens is they send that message, and then we have one of our centralized scheduling agents call them up and just give them a personal touch sort of phone call. Now, we are piloting direct scheduling, so we have a couple providers that are looking to open their schedules. The catch there is they're not going to have any rules in place, so there can be no restrictions on what kind of person you're seeing, what their condition is, when you want to see them. You just have to have open blocks. So I wouldn't start there, but I think that's probably where the industry is going. And then just as a final note here, knowing your population, we'll talk more about that on the next slide, but apps, emails, and text reminders, this sort of thing. So let's look a little bit at that on the next slide. So we have a really distinct population in our region. So I live in Athens, Ohio, which is home of Ohio University, #1 party school in the nation. And in that region, we have a lot of patients that are young. They expect things like this. They're the ones that say, why doesn't it do more? Why doesn't the app for MyHolzer do more? And that's a wonderful thing when you're hearing that, because that means they're using it. These are the folks that are ready for things like face-to-face visits via an app that they can pay with PayPal. Those are those folks. Now, about an hour south where I'm sitting today, where I come every day for work, we have an older population. These are the folks that don't even have an email address. Much less, are they interested in logging into a website or an app or anything of that nature. So you really find that you've got to cater to your population when you're describing what this thing is. Now, what I will say, I make a point to put apps as a bullet point here, because my 75-year-old mother, who isn't really great at logging into her email, can use her smartphone, and she can click the mail icon on her iPhone. So while it is a youth expectation that they have smartphones, I'm finding that the older population also are adopting the app-driven aspect of your portal. I would say if I was going to change, if I was making a list of things I would have done differently when I rolled out the rebranding effort, I probably would have focused more on the app side of it. I did a lot of, our team did a lot of working from the website driven, and I would probably have looked more at the app and used that as more of the front door for the product. And then just another thing about your population, email and text reminders. So one of the things I manage is here at Holzer is our patient reminder system. So you probably have one of those. Well, those are very expensive, and those are kind of a problematic tool just because they do. There's a difference in acceptance of it back to the youth and the older population. But you can eliminate some of those. So email and text reminders are something that nearly every portal has built in. The challenge is that your patient has to opt into them via the portal. But if you're looking to save some money, pardon me, if you're looking to maybe eliminate a product and consolidate a product, you can do that potentially in your portal. Based on your population, they can decide who's going to use that and who's going to go with the old-fashioned phone call. So next I'll talk a little bit about signing them up. So again, before the product became mine, before MyHolzer was ever MyHolzer, back when it was Follow My Health only, the folks that were in charge of it then had in my opinion, the right frame of mind to look at it and say, listen, the front desk staff are the ones that we need to look to make this part of the process. And internally, I talk a lot about operationalizing things. And I would say that you pretty much go to any healthcare organization now. The front desk staff arrives the patient, and then the last thing they say before you sit down is, can I send you an invite for our patient portal, or something to that effect. So I would really encourage you to have that face-to-face, whoever's face-to-face with your patient, those are the people that are going to get their attention the most. And I'll talk about why the provider is the most important one a little later. But I would empower that front desk staff. One of the things they did, again, I won't take credit for this because it was before me, but when getting it off the ground initially, they did some incentive programs. So whoever signed up the most patients, pardon me, would get some sort of incentive at the end of the month. So whoever signed up the most. So that was a success here. And then finally, brochures. This was one thing I did. I got to know marketing better than ever as a result of MyHolzer. And one of the things we did is we rolled out a brochure that was square. And it sounds like the smallest little thing that is not important, but it was a big deal. It was amazing. You go sit at your doctor's waiting room, and there's a wall of brochures, and they all look the same. They're all the same shape. Well, we made a different one, and I thought, let's give it a shot. Let's give it a try. So marketing developed it for me. And it's a, sort of an oddly shaped brochure, but ironically, that really gets people's attention, and it actually made them pick it up. So again, small thing that doesn't sound like much, but that created that buzz that we're looking for. Okay, so information technology. So do you want IT to have a big role in this, a small role in this? One thing that, as just a result of necessary evil kind of stuff, when the product first came to Holzer, the front desk staff were getting a piece of paper, and they were putting the patient's name, date of birth, and email address on that piece of paper, and they were inter-officing it over to Mike in IT, who was cranking out invites all day. Now, while that got the product off the ground, it was a really inefficient way to do it. It created a lag, and it also, I'm sure, made Mike's day pretty crummy, having to scroll through all those papers all day. So what I would say is, take as much of the operational part of it away from IT as possible. They've got plenty to be doing. They don't need to waste their time processing paperwork. And here's the deal. The phone center was the silver bullet at Holzer. So we have centralized scheduling here. when I moved a little bit out of IT, one of the areas that I took over was our centralized scheduling. So we have about 60 what we call agents who take all of the scheduling and prescription calls for Holzer. So I thought, how am I going to get the masses to sign up for this? How am I going to operationalize this in my world? Well, I said, I've got 60 folks that are talking to patients all day, every day. Why don't I have them talk to these patients, tell them what MyHolzer is, and send them an invite? And it was really incredible. And if we look at the next slide, you'll see what happened when we did make that change in our centralized scheduling phone center. So you can see this was in 2014, 2015 timeframe, and you can see that in 2013 and 14 there was a steady rise of patient adoption. And that summer, what we did was, one thing we did, we added our acute patients, so that attributes for that big jump. But we also included the invite to MyHolzer on every contact that came through the phone center. Now, I audit each of my agents every month, so they have a trainer that listens to their calls and says, did they do this, 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 and this? Well, one of the things we added was, did they invite patients to MyHolzer? And you can see the dramatic jump there, and the climb became far more rapid. So, like I said, you're looking at 100,000 calls a month, 1 million a year. Each one of those contacts, the person on the phone looks at our EMR, and it says whether or not they are currently a registered user of MyHolzer, and if they're not, they have a script that they read them, and then they send them an invite. So, so this is just one of those nice proof is in the pudding sort of things. So next, the provider. I would say this is the single most important strategy for ensuring patients adopt the patient portal change. If you can successfully do one thing, do this. If you can get your, a provider to have an appointment with a patient and say, hey, sign up for MyHolzer, send me a message about XYZ. This is what's going to get patients to adopt a portal. It also happens to be the hardest thing to do, because getting providers to say something to patients and to even understand that themselves is extremely difficult, as we all know. So if you can get their buy-in and get them to adopt this as their culture, the patient doesn't want to listen to marketing material, but they'll listen to their provider every single time. So some of the keys to that at the bottom you'll see there. If you have a CMIO, he or she is the key to success here. He or she will understand both the IT side of what you're doing and the clinical side of what you're doing. So they have that respect with their peers. So if you can get your CMIO on board, then that person can relay that message for you. And then I always talk about Dr. Sheets, and he gives me his permission to use his name because he drives me bonkers. I used to have security as one of my responsibilities, and this is the guy who texts his patients. So he's a wonderful man who cares deeply about his patients, but he will text them, it's 8 p.m. on a Sunday night about, Johnny's runny nose or whatever it is. And I always struggle with that from a compliance perspective. And I got to talk to him and explain to him why you can still have that sort of communication with your patients, but you can do it in a secure way. And again, just the struggle, getting them involved. I mean, these are just some of the highlights, but getting them involved is what I think is going to make the biggest difference for you. So a little bit more mundane, let's talk a little bit about meaningful use. Let's face it, like I said before, that's why we have portals, because meaningful use came along and we had no choice. But don't let that distract from the wonderful things that the portal brings to your patients. And when you're out and about talking about it, I'll talk a little bit about marketing here in a sec, and I'll hustle up here for you to get to it because I think it's most important. But let's just talk about meaningful use real quick. So 3 stages, of course, if you're involved with meaningful use. That was the reason MyHolzer was given to me, why it became my platform, because we really had to get going on these portal measures. Stage 1's easy, right? So just getting an invite, you can pull that off in a whole lot of ways, and having the electronic copy of things, that's pretty easy. Now stage 2 was where it got super difficult, because my biggest gripe with this is how can I be held accountable for patients' behavior? I mean, I'm being measured on messages from a patient to a doctor, and clearly the onus has been put on us as healthcare providers to get our patients doing this, not vice versa. So it was really tough, and that's really what we're every slide we're talking about today is about affecting change culturally for people, not our people, but patients as a population. And then I don't, like I said, I don't have the platform anymore, but as I understand it, stage 3, the requirements are the same, maybe with a little bit more tweaking, and Scott can answer those questions if you have anything about that. So the next few slides, I wanted to just show you some of our marketing efforts, because you know what you're doing is getting patients to adopt a culture, like I just said a minute ago. So how do you do that? Well, I actually took a marketing course, to be honest with you, when I started this journey on Portal, and focused a lot on marketing, all the different channels of marketing, and I attended every single event I could, whether it's the Better Business Bureau, not the Better Business Bureau, the like the Rotary type stuff, these types of any event. You can attend to talk about it. Sign yourself up and do that. And here's the things you want to talk about. You want to say you can message your doctor, you can renew your prescriptions, and you can schedule an appointments. And on the marketing stuff, the thing I would say is I've learned about marketing, no matter what you want to market, you got to give away an iPad. People will do anything for a free iPad. So I was really shocked at how much that helped us. But what we did was we gave away an iPad a month for 12 months. So each month, people that did what we asked of them were entered into a drawing to get a free iPad. And that shocked me how much attention we got for that. So I would say to do that. So what you see on this slide is this is just the landing page on our primary website. So nothing exciting here, but this is for the folks that actually do want to look into what is this MyHolzer thing if they want to read about it for themselves. Now, if we advance a slide, you can see some of the tools that we used here. We have what we call the Community Connection. That's a product that we, or a publication that we send out to all of our patients monthly. Anything you publish, whether wherever it is, it's going to have your phone number and your website. Get your marketing department to add myholzer.com. Get them to add whatever your branding is for your portal, so it becomes a means of contacting the organization. Again, more you can look at this later, but the requirements on the right there, what they had to do to win an iPad. Skip ahead a slide here and we'll see more of the iPad campaign. This was meeting our end of year goal, of course, by December 31st. On the right, what you see is this was the poster that was going in the lobby. So this was the thing that we were putting out there and letting patients see. We did digital marketing, we did print marketing, and we also did, I did a few interviews on TV, those sorts of things. And the next slide just shows you that it works, and you'll see that the daily usage of our portal at that time was going really well. This has climbed. We're doing in the 4,000 range, I believe, now. So really wonderful numbers there. So one more thing I want to say on the next slide. When you are talking to everyone you can, when you are marketing this, these are my boys here getting on the bus. This was the one thing everyone could relate to. If you have kids, especially little ones, you know that you always have to provide their immunization records. And in my personal life, I found that when I can give my personal examples of the product and what it does, that's when you explain to someone why this product is cool and why it can change your life. With both the boys that you see here, I was at their kindergarten registrations at different times and did not have their shot records. And we all know the routine of, calling your office, getting it mailed to you, going by the office to pick it up. In both those situations, I sat at the teacher's desk, pulled up MyHolzer, and printed the shot records and had them. And I've used that 3 times since. So that was one that everybody can relate to. And the next one was a little bit of my personal journey. So I used to be a lot bigger guy than I am today. And this one gets people's attention more than I ever thought it would. But I like to show people why it's cool, why it's a fun product, and this was one that really landed with people. It showed them that look, you can track your weight over time. As you can see, if you look at a little bit of my personal life, you can see I've dropped a whole lot of weight and kept it off for a long time. And that was something that when you show that to people, they say, oh, you know what, maybe this isn't something that my hospital's just trying to push on me. Maybe this is something that can benefit me. So that really was just sort of the personal thing to make it cool. And that sums up the marketing piece, and I will say it again here in a second, but 3 takeaways. Defining it, like we talked about, you got to tell them what it is, what it's going to mean to them. Let them know it's going to change their life, that it's cool, that they're going to be registering their kids for kindergarten, and they're going to actually use this thing, and it's going to change the way you operate. And then, again, how it'll improve the management of your health issues. Scott talked about this earlier, but this is the future of what we do, right? Like when you have a patient fill something out ahead of time to answer a bunch of questions on their portal, they attach value to it, and then they're going to be a lot more successful in their care. Number 2, be proactive. You can't build it and they will come. You got to do this. Just like location, location, location is a big deal in real estate. With this, it is marketing, marketing, marketing. I'm telling you, go take you an online marketing course, get to know your marketing department really well, and push it everywhere you can. And then finally, the reason we're all here, meeting meaningful use. This is something that they've never had before, but these benefits that we talk about are what meaningful use is all about and why we're being required to do these things. So that ends my section, and Scott, I'll give it back to you, and we will answer any questions you have in a bit.
Perfect, Kevin. I appreciate it. Great presentation. You know, the information you shared is going to be beneficial to anybody, large or small organization. So thank you, thank you, thank you. And hang on for just a second, Kevin, and then we'll roll right into the questions. But I did want to kind of provide some recommendations and kind of wrap a few things up. Just keep in mind that just having that patient portal does not mean you are going to have engaged patients. It's not going to replace office-based care. It's just one tool in the tool set, but make sure you are using it to its fullest potential. When you're rolling out your portal, whether it's from the very first, you're bringing that portal up technically, or you're developing your marketing plan, your rollout plan, you need to be flexible. If you develop a very rigid plan, the first bump you hit along the way, you're going to derail, it's going to stop things. Make sure your plan is very, very flexible. Sell the portal. It's a sell job both internally and externally. There are folks that are going to not believe in the portal. They've heard that, you know, the practice down the road got a portal, and boy, they're just overwhelmed now with all of the work that causes. Get in front of those messages. It is an internal sell job as much as it is an external sell job. Don't jump right in to incorporating patient-entered data into the portal and into the record. Work up to that. When you are marketing, like Kevin shared from the beginning, focus initially on the utility functions, the convenience functions within that portal. You know, requesting an appointment, refilling your meds, and in some portals making a payment. That will get folks in the door, and then once you're in the door, you can grab onto them for real patient engagement. And always push your vendor. If there's something in the portal that you don't feel is usable, or you're getting feedback from patients, push your vendor to continually improve and extend functionality in that portal. So with that, I'm going to open it up to questions, and we have a few, Kevin. So let me start. We are a small practice and don't have an IT department or a call center. How can we engage our patients?
So yeah, I mean, what I would say to that is what I said about the face-to-face stuff. When you're a small practice, I actually worked with a dermatology practice locally here, and they had that same challenge. And what we did was that sort of scenario that I talked about. You know, that face-to-face person, that receptionist that's arriving the patient. That's your key there. That, along with your doctor, get that receptionist to be the one that is selling this product for you, and you know, answering the questions when the patients say, "What is this? How do I use it?" Take some time to spend with that receptionist and get he or she on board with what it is. And I think that face-to-face is probably your answer there.
Yeah, and I always, for the small practices, always recommend that you lean on your vendor. Ask your vendor for other sites that have been wildly successful with the portal. And I've found that folks are always, those folks that have been successful are always very, very willing to share on, the methods that they use. Lean on your vendor also to help if you have some technical issues. So, next question, how does all this relate to my patients with chronic conditions? Well, again, the portal is just another tool in your suite of tools to engage those patients, to share educational information with them, to get them engaged in their own care, whether it's diabetes, hypertension, or any other of the numerous chronic conditions that our patients suffer from, providing them with another channel to educate themselves, to reach out to their care team, absolutely critical.
And if I can add to that too, this is back to my weight loss example. I mean, having the portal has gotten as a patient, you have that ability to go and track your chronic condition. So whatever it might be, it's your weight, your blood pressure, those sort of things are going to play into that. And like Scott said, you look into those historically, and you encourage the patients to track those things themselves, participate, add demographic information if they want, and talk to their provider through that journey.
All right, next question. What are some recommendations for physician engagement? Our physicians have some negative feelings because they are unhappy that results are falling over to the portal in 24 hours to meet the 36-hour meaningful use requirement.
So easy answer there. You can limit what goes there, and I won't. We can talk about it after the fact. I won't get into the nitty-gritty here, but having results and having all of your results published are two different things. Rightfully so. If you're publishing everything within 24 hours before they get a chance to tell them, yeah, that's no good. I mean, you want to just do normal results. Certainly no. HIV kind of stuff. You don't want to be pushing those sort of results. And if you have a team that can limit those, great. If not, your vendor will absolutely have experience with that. Whoever your portal vendor / EMR vendor are, they should have standards with that. And you just got to educate your docs that it's not everything. It's only normal stuff that's going to go across.
And that question came from Amy, who actually is using the same portal as you guys down at Holzer. So, Amy, I will hook you up with Kevin's contact. Actually, if you don't have it here, I will hook you up with that later, because I do know the Follow My Health portal does allow you to kind of block and hold those non-normal results. So we will hook you guys up. Can you briefly describe the pathway from patient request for med renewal to provider renewing? Is it completely electronic, or is the staff retrieving a message from the portal and then keying that into the EHR?
So it is as you describe. To the patient, it's completely electronic and seamless. What in actuality what happens is they submit that request online. I mean, you nailed it. I have a group of 3 people that manage our portal communications. They convert that to a task for the provider, and they send it over. The doctor, does whatever it is, whether they renew the script or deny it, whatever. That task then gets converted back to a message on the portal manually. Well, while that's not ideal, it is seamless to the patient, and it is no more cumbersome than a phone call would be. So from the patient's perspective, it is seamless, but the reality is exactly as you described.
And that does vary by vendor. I have seen patient portals where that request stays as a task that flows then to the provider's task list and doesn't require the manual intervention. You're going to find that varies by vendor. Okay, last one. Because we have 2 portals within our system, patients can and do access the results before the provider. Then they call the portal support line, which brings to the IT office to ask medical rather than technical questions. So that gets to 2 points. First, there is heightened patient anxiety when results are pushed out without the provider involvement. Second, clarification and marketing is paramount to success. So I guess that was more of a statement than a question, but I go back to that heightened anxiety with the patient. That, in my mind, it's not necessarily a bad thing. Now, I do agree that you don't want your patients to find out that they have some major condition from the portal. You know, they need to find out if they have cancer. They need to find that out from their provider. But that anxiety, that calling in, that is the basis for patient engagement. The patient now knows they have access to those results. They have access to their care team. They can ask questions. Man, if there's somebody on the other end of that line that can put them in touch with their care team, answer that question immediately, you have laid the foundation for a very successful patient engagement program. Kevin, I believe that's our last question. And again, I want to thank you a million times for participating and writing the article and preparing slides for today and with the presentation itself.
It's my pleasure. Thanks for having me. And like I said, I mean, the only reason any of us are successful is because someone helped us. So please reach out to me if I can help you in any way.
And for those that are attendees on the call today, a recording of this webinar will be available on the CliniSync YouTube site here within the next couple of days. With that, thank you all for attending. Please take the time to fill out the survey that you will get as soon as you close out of the webinar. And we will talk to you all soon.